How would you react if you were told that cancer is curable? Its causes are known and there are hundreds of successful treatments, some of which are about 100 years old. No doubt it would at the very least cause you to be surprised and disbelief, and most likely a rather emotional reaction of denial. This is exactly how I would have reacted just some 10 years ago. Why was it not so long ago that I could rush into an argument with fervor and passion and use arguments from the knowledge I had acquired at school and institute to refute such a statement? Back then I was convinced that if I hadn't been taught it or heard about it, it simply couldn't be true. It is much easier to deceive a person than to convince them that they are being deceived. Mark Twain, it is projected that in America, 1 in 2 men and 1 in 3 women will get cancer in their lifetime. Other developed countries are also approaching similar statistics. In Russia, the statistics of cancer incidence is constantly increasing. Now every 5th, 6th person gets cancer. And if the state of affairs on solving the problem in this sphere does not change dramatically, Russia will soon catch up with America on this unenviable indicator. Over the years of the war on cancer, in quotes, a steady trend has emerged. The more money is invested in oncology, the more cancer patients appear, and the more patients, the more profit the big pharmacological industry gets. Did you know that the cancer industry employs more people than are treated for cancer? The annual turnover in this industry is hundreds of billions of dollars. And now think about it. If at least one of the dozens of existing drugs or treatment protocols that will solve the problem of uveitis is found, or rather recognized, what will happen to all the oncology clinics, diagnostic centers, doctors, technical administrative staff, as well as manufacturers of expensive diagnostic equipment that are involved in this industry? Did you know that U.S. insurance companies pay an average of $350,000 per cancer patient, and they don't pay a dime for in-kind treatment? A course of treatment for a foreign patient in the USA, Israel, England, and other Western countries costs from $250,000 to $1 million. The cost of drugs or a combination of drugs included in a course of treatment ranges from $3,000 to $20,000 per month. The profits that pharmaceutical companies make from the sale of a single chemotherapy drug can be as high as 500,000% by comparison. The Gerson Protocol, which has a 90% success rate in treating cancer, costs only a few $100s a month and only $25,000 for a short course of treatment at a clinic in Tijuana, Mexico. Bill Henderson's protocol costs only $5 a day, and Dr. Sirkus protocol is even cheaper. Some at-home treatments can cost as little as $50 per month. It's naive to assume that official oncology, big business, and the politicians they buy will sincerely try to cure cancer. Organizations like the American Cancer Association, the British equivalent, Cancer Research UK, and their similar large cancer charities receive billions of dollars in subsidies a year. Not a dime is spent on research into natural and far more successful alternatives, whereas all the money, after paying huge salaries to the heads of these organizations, goes to research into dead-end research, such as chemotherapy. Very often, the heads of these charitable organizations come to management positions from big pharma or vice versa. Natural methods, their authors and specialists applying them, are subjected to gross pseudoscientific criticism and discrediting. For this purpose, special sites are created. Wikipedia is controlled. One can cite many more examples in traditional oncology, where the interests of big business profit prevail over common sense and people's interests. Here are just a couple of such examples. Mammography, which is recommended for women after age 40 every year, is itself carcinogenic. There are studies that prove that with each mammography, the risk of cancer increases by 1 to 2% annually. In addition, this method is quite expensive and quite inaccurate. It is believed that misdiagnoses are made up to 40% of cases. At the same time, there is thermography, which has a diagnostic accuracy of 98%. It costs 4 to 5 times cheaper and is an absolutely harmless procedure. Nevertheless, the medical establishment does not introduce it into widespread use, and it can be found only in selected small centers and clinics. Another example is the breast cancer gene test, which costs $3,000. Despite the fact that having a mutation in the BPA-C1 and BPA-C2 gene is absolutely not enough to start the disease, and that the most important factor in controlling this gene is nutrition and other external factors. This test, however, has become more and more widely used and will probably soon be recommended for all women. If the medical establishment were interested in preventing breast cancer, it would be much easier and cheaper to explain to women who have a bad heredity that they simply need to change their lifestyle and diet, reduce their stress levels, remove as many carcinogens from their lives as possible, and detoxify their bodies regularly. I am convinced that, knowing this, far fewer women would go for a mutilating preventive double mastectomy, the breast removal surgery that official oncology is trying to popularize as a method of breast cancer prevention. What will it offer us next? Cut out one lung, one kidney, and thus halve the likelihood of cancer of these organs, after Angelina Jolie's provocative statement in 2013 that she removed both of her breasts to prevent cancer. Many women began to follow her example. Not to be appeased, in 2015, she removed her ovaries and fallopian tubes for the same purpose. There have already been cases in England where men have followed her example and removed their prostate in order to prevent prostate cancer. In fact, of the 10 patients who beat cancer in the 4th stage, all 10 will be those who were treated with natural methods. Only in the 1st, 3rd stage of cancer can you find a small number of people who have been cured using the methods of traditional oncology, surgery, chemotherapy, and radiotherapy. And as the famous German scientist and physiologist Jana Budwig said, we don't know whether these people were cured thanks to chemo and radiotherapy or in spite of it. Visi oncologists, when after a certain amount of cycle and chemotherapy, and when it is realized that heavy treatment will not lead to a positive result, let the patient go home. Thus, unintentionally, they give the patient, even if small, but a chance that the body will recover and continue to fight the cancer on its own, or has no other choice. The patient will seek other treatments that are more likely to lead to the extraction or stop the disease. Many who have beaten cancer using folk or natural methods have been just such refuseniks. Working in expensive hospitals, overseas oncologists will gladly accept such refuseniks. If they are ready to lay out hundreds of thousands of dollars for treatment, there will be courteous will treat them carefully, bringing them to the inevitable result. That result will be death from complications of treatment, which in 99% of cases is officially defined as resulting from the aggressiveness of the disease. Unfortunately, official oncology is not only not going to change its methods, which bring it billions of dollars a year, but on the contrary, tries to cover more and more people with these allegedly preventive examinations and crippling treatment. In the last 10 years, more than 1 million women in the US have been misdiagnosed and treated for cancer. Apparently, this state of affairs suits the medical establishment and the big business that controls it, because the more people are examined and diagnosed with cancer, the greater the profits will be.